to all consumers at heavily discounted prices of anywhere between 50 and even 100%.
Affordable prescription drugs online. The platform will be called TrumpRx, and it would allow consumers to buy drugs directly on a government website.
Do you really think this is an historical moment?
Nobody expected this. Donald Trump just struck a deal with Pfizer that promises drug prices in the United States could drop by as much as 85%. And it comes with a brand new government website called TrumpRx, designed to let Americans buy medicines directly at supposedly cheaper prices. Sounds huge, but here's the real question. Will this actually save Americans money? Or is it just another announcement that looks good on TV? Here's the truth. Americans pay nearly 3 times more for prescription drugs than people in countries like Canada, Germany, or the UK. Insulin that costs $30 in Canada can run over $300 in the US. Cancer drugs, arthritis meds, even basic ointments. Families here pay the highest prices in the developed world.
In U.S. news, the president announced a deal with Pfizer today.
People across the country leaned in, because if those price cuts are real, it could be life-changing. But if not, it's just more frustration for millions of patients already struggling. On September 30th, Trump stood at the White House and unveiled his plan. Pfizer, one of the world's biggest drug makers, agreed to 3 major things. First, it will sell many of its primary care medicines and some specialty drugs at discounts averaging 50%, and in some cases up to 85%. Second, it will match what's called most favored nation pricing. That means Americans won't pay more than the lowest price offered in other wealthy countries. And third, it will participate in the new TrumpRx website, expected to launch in early 2026, where patients can search for their prescriptions and buy them directly. Trump called it,
This, in terms of pricing, it's going to be great for Medicare.
Pfizer called it,
Do you really think this is an historical moment?
but experts quickly warned, the story isn't that simple. Pfizer gave a few dramatic examples. The menopause drug Duavi, dropping to just $30. The bladder drug Toviaz, cut to $42. The eczema cream, Eucrisa, down to $162. Those numbers grabbed headlines. But notice what's missing. Life-saving, high-demand drugs like insulin, blood thinners, or cancer treatments. That's why health experts are asking, are we talking about the medicines people desperately need every day? Or just a few niche drugs that make the discount look bigger than it really is? Here's the part most people didn't see in the headlines. This deal wasn't just about cheaper drugs, it was also about tariffs. Trump had threatened to slap a 100% tariff on pharmaceutical imports unless companies brought more manufacturing back to the US. Pfizer, facing that pressure, agreed to invest $70 billion in US research and manufacturing. In return, the company gets a 3-year break from those tariffs. So while Americans are promised discounts, Pfizer walks away with huge protection and perks. Not everyone is convinced this will really help patients. Drew Altman from KFF said, "This only applies to one company and one program. It's not a system-wide fix." Stacy Dusitzina, a professor at Vanderbilt, explained that most Americans use their insurance plans to buy medicine, and direct-to-consumer sales, like what TrumpRx will use, often require patients to pay cash. Her blunt assessment, this won't help the average person. That means the uninsured may get some relief. But for the majority of Americans, insurance rules, co-pays, and pharmacy middlemen still decide what you pay at the counter. So ask yourself this: if the discount looks great on paper, but doesn't reach the people who need it most, is it really a breakthrough or just a political headline? The public reaction has been split down the middle. Supporters flooded social media celebrating. Clips of Trump promising 80% discounts went viral across TikTok and X. But critics were just as loud. Others pointed out that even with a 40% discount, a drug like Xeljanz would still cost more than $3,000 a month. People are worried because behind all the noise, the pain of high drug prices is very real. Let's pull back. Prescription drugs make up about 10% of all healthcare spending in the United States. And in survey after survey, most Americans say the cost of medication is simply unaffordable. That's why this announcement hit so hard. For some, it was hope. For others, it was hype. But either way, it speaks to the core issue. Americans are desperate for relief. And any promise, even one that may not be fully real yet, sparks attention, arguments, and headlines. There's also a political shadow here. Trump already tried most favored nation pricing during his first term. That plan collapsed in court. This time, instead of waiting for Congress, he's striking private deals directly with companies. Pfizer is the first to sign on. Others may follow, but legal experts are asking, why make new deals when Medicare drug pricing negotiations, already passed into law, will begin in 2026? It raises the question, is this policy about real reform? Or about headlines and political credit? Imagine it's 2026. You go to TrumpRx. You search for your prescription. The price tag drops on screen from $500 to $50. Would you believe it, or would you be waiting for the fine print? That moment of doubt is exactly why this story has America divided. So here's where we are. TrumpRx is promised. Pfizer has signed on. A handful of drugs have dramatic discounts attached to them. And Americans, once again, are left wondering if this is the start of something big, or just another political showpiece. If it works, millions could finally see relief at the pharmacy counter. If it doesn't, it's just one more reminder of how broken the US healthcare system really is. Either way, this deal has already made headlines, moved markets, and stirred up a national debate. So now, the question is yours. Do you think TrumpRx will actually deliver cheaper medicines to American families? Or is this just another flashy promise that won't change the reality at the pharmacy counter? Let me know in the comments. I'm reading every one of them. And if you want to stay ahead of the next big story shaking America, make sure you hit subscribe right now, because tomorrow there's going to be another headline you won't want to miss.